Good afternoon again, and I'm Dr. Lanka, the President of the Sri Lanka College of Pulmonologists, and we, together with the National Program of Tuberculosis Justice in Sri Lanka, are responsible for the majority of managing patients with tuberculosis, and especially that when you're looking at the clinical aspects of managing tuberculosis, College of Pulmonologists are one of the main stakeholders. So hence we see the damage that is done by tuberculosis to our patients. So when we look at tuberculosis, that is one main reason that we are having this media conference with you today. We really don't understand the gravity of tuberculosis in the community in Sri Lanka at the moment. Because even in the health sector, if we ask certain people about the tuberculosis content or the amount in Sri Lanka, they will say tuberculosis is a problem in Sri Lanka. So it is a problem in Sri Lanka because we actually have about 750 to 760 deaths per year because of tuberculosis, which is a completely preventable disease, a curable disease, and it is given free of care, free of charge in the Sri Lankan context. And we suffer a lot because of tuberculosis, not due to deaths only, but because when you have tuberculosis, as Dr. Nisaya correctly pointed out, you weaken yourself physically, mentally, and at the same time economically as well. These people will have reduced earning capacities, hence their families will go into a catastrophic phase where they will not be able to get adequate amount of food into the table to feed their children and their loved ones. And the third important thing is, even if we cure tuberculosis, if the diagnosis is late, unfortunately, tuberculosis can affect all organs of the body except nails and hair. So if it affects the lungs, there will be permanent scars in the lungs, and this person, imagine an 18-year-old or 19-year-old girl having tuberculosis with completely destroyed lungs. We see it in a daily basis, and this child will probably not be able to do a proper job in future. She will not be able to have a child in future. And her lifespan in Sri Lanka currently, fortunately, a female will live up to about 86 years. But these children, when they get tuberculosis, these adolescents, these young adults, when they get tuberculosis, because of this damage, their lifespan will markedly reduce in about 20 to 30 years. So it is not a simple problem that we have with tuberculosis. It's a complicated problem that we have. But we have simple solutions. The most important thing is, I think, especially in districts of Colombo, Kalutara, Gambaha, Kandy, Ratnapura, and Galle, we have to actually have a concentrated effort in diagnosing these patients with tuberculosis early rather than late. And we have certain mechanisms that are in place, but we have to educate our public, especially regarding the early symptoms of tuberculosis. Especially when you look at the lung tuberculosis, let's say cough is one of the main important things. They will have loss of weight, and sometimes they will have fevers coming in and off. And as I told you previously, it can affect any organ. So depending on the organ, there will be changes. So especially if we have a tuberculosis patient at home, there is a high risk of getting tuberculosis in the other patients, especially children less than 5 years, as well as children less than 15 years as well. So when we have a contact history of tuberculosis, we have to be careful to diagnose these children and adolescents as early as possible. So hopefully, with these measures, and I'm happy that the National Tuberculosis Program has had many programs that are lined up in a few weeks that is coming ahead. And we are actually planning in the district level to have multiple programs involving our media colleagues so that we can join together and educate our public about this important aspect. And hopefully, together, we will be able to have an outcome that will be better for our mother country. Thank you very much.